No, it says record in 2 places, so I'm hoping that means it's working. Okay, so what we're going to begin talking about are, and I'm going to call them the 4 phases. I think your instructions in your paper say 4 stages, because that's what we've always called it. But I'm going to talk about 4 stages. I'm going to tell you first of all what they are, just the titles, and then we're going to talk about what that means, what it's really about. The first stage of Adlerian psychotherapy is building the relationship. The second phase is assessment. The third stage is referred to as intervention or insight. And then the final stage is called reorientation. Okay? So let's start with the first stage, building the relationship. So here's where you get involved. I want to ask all of you, anybody can answer, what do you think a therapist would need to do if you were in therapy with them? What would the therapist need to do for you to begin to feel like you have a good relationship with your therapist?
Show empathy.
Show empathy. Absolutely.
Eye contact.
Say it again.
Eye contact.
Eye contact.
Let
Yep.
me do most of the talking and they do most of the listening.
Okay, so let the client talk and listen. What kind of listening do we want to do?
Active.
Active listening. Does everybody know what active listening is? I see some nods and some not so nods. Active listening is not only listening, but stating back to the client what we heard them say in our own words. And so they know that we actually heard them. And it makes them feel like you are really listening. You really get it, what I'm trying to say to you. Okay? What else would have to happen for you to feel like you've got a relationship with your therapist?
Hospitality.
Hospitality?
You know, like, can I make you a cup of tea?
Well,
Like that.
you don't have to do that, but I think you're kind of saying be welcoming, are you not?
Gracious.
Gracious, welcoming. Okay? What else?
So the clients I've worked with want to know if you're qualified.
They want to know if you're qualified. Okay, are you some nutcase that just hung up a sign over your door to say, you know, I do therapy, or do you really have some credentials? Some people are really keen about that, others figure, well, you must be or you wouldn't be doing this.
Encouraging.
Encouraging, not just maybe, absolutely.
Okay.
Every client that comes through your door is discouraged. So you want to give them encouragement. How can you encourage somebody when they've just come in and dumped every problem they have on you?
Look for their strengths.
Look for their strengths, good. And is that gonna help build a relationship? You bet. Okay? So, what else?
That being validating and not judgmental.
Very good. Validating and not being judgmental. We don't have to agree with them, but we do have to understand where they're coming from and not judge them. And trust me, a lot of these people have been judged a lot. Anything else you can think of?
Find something that you can connect on.
Okay, that's a good one. What do Adlerians emphasize about how we view people and how we treat people?
Accepting.
We accept people. What are some of the words that you've heard?
Quality.
Equality. You know, there are a lot of people that are therapists, psychotherapists, psychologists, or psychiatrists who act as if they're superior. We are not superior. We are social equals with our clients. We are equal collaborators with our clients. Okay? Anything else you can think of? All right. What about hope? Do people need to have hope if they come to counseling?
Yes.
Absolutely. You know, I've seen people's whole demeanor change in my office because I would say to them, you know what, I think we can fix this. Things will get better if you just work on the things that we talked about. And it's like, oh, thank goodness, finally somebody believes that there's hope for this situation. So hope is very important. There's another thing that's very important that we really emphasize a great deal in Adlerian psychology. And it's a bit different than what other therapists do. So pay attention and remember. We align goals with the client. What does that mean?
You're working on their goals together and not just you telling them what you think they should work on.
Right. And who else decides on goals for clients as a rule? What?
The client.
The client, but who else? Who's worked at a clinical agency?
The team.
What?
The team.
The team? How about the county? How about the parole officer, the probation officer? All these other people, sometimes they're referred to an agency with a list of what you are supposed to accomplish with this client. And you know how the client is feeling? Well, think about it. If you're the client, and your previous people that worked with you that probably you got in trouble and they're trying, you know, they're accusing you, judging you, doing all that stuff. Now they referred you to another clinic and they've sent with you a list of things that this person is supposed to work with you on. How are you going to feel about your therapist now?
Like they're a punishment and they're just another piece in that control factor.
Okay. And whose side is this therapist on?
Not on yours. I'm a therapist.
Okay, one clinic couldn't get me to shape up, so now they brought in the big guns. Now it's 2 against 1. Now what you will discover is that when you say to your client something they've never heard before, what is it that you would like to accomplish by being with me? If you could have things turn out the way you want, what would we have accomplished here? And you align goals with your client, you will discover on the way to achieving your client's goals, the other agency's goals will in fact be taken care of. So for example, you have a client that you're seeing and you say, what would you like to accomplish? And the client says, I'd like to get the county off my back. And I'd say, great, that's a great goal. Now, what are we gonna have to do to get the client off your back. Well, now whose goals are we accomplishing? But the client is looking at it totally differently, because you're not here saying, look, this is what you're gonna do. You know, you're gonna go to this class, you're gonna do this, you're gonna do that, and you're gonna do that, and if you don't, you're gonna lose your kids. Instead, you know, we're saying, oh, okay, you wanna get the county off your back, or you want your kids back, let's figure out how you can accomplish that. Now, whose side am I on?
Their side.
The client side. Totally different. Part of building the relationship is having the client believe that you're really there to help them, not the county or some other agency, to help them. When they really feel like you're helping them, and you're empathetic, and you're doing active listening, when you're doing all of those things that we've already mentioned, what's going to be accomplished?
Trust you.
What?
They'll trust you.
Bingo. They will trust you. You know, clients come to therapy. They don't necessarily hire you. They put you on probation. Only when you have built the relationship and they have come to trust you do they actually hire you. That is when the real work begins. Do you see that? Okay. So, building a relationship is extremely important right up front. Before you do anything else that matters, you've got to build that relationship. And you have to really focus on that in the very beginning of therapy, but you have to do it all the way through. Because having a good relationship with your client is half the battle. If you read about research, research will tell you it's more about the relationship between the client and the therapist than anything that's done in the therapy. But what we are also doing as we build the relationship is we're demonstrating to the client what a healthy relationship looks like. Another principle of Adlerian psychology is mutual respect. Right? Who can define for me mutual respect?
Well,
Give it a whack.
in my, no, 'cause I don't know if this is it, but, I mean, in my line of work, I meet the client where they're at. And so, in giving them dignity and respect, I get that in return, so it's kind of mutual. 'Cause
Okay.
I'm understanding
You've done
where
very
they're-
well on part of this, and basically what you have described is what most people would say is mutual respect. I'm gonna define it in a different way. The first part, I agree with. Respect is something that I show you. I treat you as my social equal. I treat you respectfully. I don't put you down. I act as if you are a worthwhile human being. Right? The other part of mutual respect is I respect me. Because we also need to demonstrate to our clients, I respect you, but I also respect myself. And if I respect myself, then I am not going to tolerate disrespect. If you expect to be treated with respect, you get respect. But you have to expect it and you have to give it. And if a client treats you in a disrespectful way, you have to stand up and say that's not okay. And you demonstrate what a healthy relationship is. Because in a healthy relationship, you respect the other person and you respect yourself. You cannot make another person respect you, can you? How do you make somebody respect you? Can't do it. But you can win their respect. And they will respect you by the way you treat them and the way you treat yourself. If you let people walk all over you, if you're a doormat, do people really respect you? No. You know, I often have to ask who they think of as a self-respecting person that they've ever seen in their lives. Clients, so they have an example. Who's a person that respects themselves and also respects others? Who have you ever known, seen in TV, movies, or anywhere in the world has mutual respect? You know who they come up with first? Oprah. Oprah has self-respect and she respects others. Great role model. Sometimes it's Barbara Walters, but usually most often it's Oprah because so many people have seen her and been able to watch how she functions in relationship to others.
Do the men say that too?
Some do,
Wow.
if they've had a chance to see her. Yep. So, this is what you do to build a relationship. And that, as I said, is the first phase, but it is something that you're consciously aware of maintaining and continuing to build a relationship with your client. Because without that, you've lost it. All right? Any questions about building the relationship? Yes?
I never thought about client coming to you and start to behave disrespectfully. Can you give an example? Because I can imagine teenagers.
And they might yell at you. You know? Do you think screaming at you is respectful?
No, I don't, but I just don't see.
You don't think the
How-
client would be disrespectful? How about if the client tells you you don't know what you're talking about?
Okay, and what do you do then?
Say, well, you have a right to your opinion, but I have degrees and I've studied a lot in this and I've got a lot of training in it. You know, I stand up for myself, I don't just take it. Do you see what I'm saying?
Yes.
If you let somebody walk over you, then you're not being respectful to yourself. Okay? And if they think that you will let them do that, they will do it more often. If they find out right away that's not gonna work with you, they don't do it anymore. Think of, you're a woman, so let's think of a couple where the husband is verbally abuses his wife. How's he gonna treat you? Same way. Are you gonna let him do that to you? Are you gonna demonstrate to his wife, this is the way what women allow men to do? Or are you gonna be respectful to him, but also respectful to yourself?
What I can think of is, I just say, we are not going to going by this way. If you will not stop behaving this way, we'll just stop it. Oh, but what if you just stand up and walk away?
If you walk out of the session?
Yes. So you just don't want to turn them away, everybody?
Well, I don't think it would be appropriate as the therapist in charge to walk out of the session. Now,
No,
you,
not me. He was yelling at me. I said, no, it's not going to work.
if he walks out, that's his choice.
Okay.
You could also say, you know, you do have to treat me with respect and treat your spouse with respect. And if you find that difficult to do, then we have to terminate the session. But you're not taking it. Do you see what I'm saying?
Yes,
Okay? All right, so moving on, the next stage that we talk about is assessment. Now, when people come in, they tell us about their problems. And so we assess what are all the problems that are going on here. We also assess symptoms. As Adlerians, we don't particularly like diagnoses, but we are forced to do that for the sake of insurance. So we do have to identify what the symptoms are and what the diagnosis would be under those circumstances. And that's kind of like the tip of the iceberg. But if we really want to assess, one of the things, do you remember the vertical and the horizontal plane? So on the vertical plane, what are the two options?
Inferior or superior?
Okay, inferior or superior? Every client that comes in your door has feelings of inferiority. We need to assess about those feelings of inferiority. How do they feel about themselves? Do they feel worthwhile? Do they not feel worthwhile? I guarantee you, they either do not feel at all worthwhile, or they don't feel they're worthwhile enough. One mistaken belief that you will always have to deal with your clients. Okay? We have to assess for the mistaken beliefs. That's the deeper level. For why do they feel inferior? Why are they behaving this way? Why is this happening? What are the mistaken beliefs and how do they need to change in order to help them to achieve their goals and be healthy? There are mistaken beliefs about how they view themselves. There are mistaken beliefs about how they view others. And there are mistaken beliefs about what they need to do to move away from feelings of inferiority. Because moving away from inferiority, they are mistakenly trying to overcompensate for feelings of inferiority and go to the other extreme, trying to be superior to others. More mistaken beliefs. So assessment involves identifying their private logic, and so that in the course of therapy we can help them move from private logic to common sense.
Could you repeat this? Assessment.
We're trying to help the client, we want to help the client move from viewing the world with their private logic to viewing the world with common sense. We want to help them move from extreme views, polarized views, or generalizations. All men are mean. All women are controlling. Or you're either an abuser or a victim. Only two choices, one extreme or the other. I'm either perfect or I'm a failure. Another example of extremes. Those are all mistaken. And we have to help them to understand how they came to believe what they believed, what was mistaken, and then with the common sense they now have available, which they didn't have available back when they were 3, 4, 5, to re-decide what those beliefs will be and act on them. okay? So we also assess what, sometimes people are functioning out of mistaken beliefs. Sometimes people are functioning from educational deficits. If your parents never raised you, because they were both drunk all the time, and you're now raising children and doing a really lousy job of it, it isn't because you're a lousy parent. It's because you are lacking the tools you need to parent because you never were parented yourself. So sometimes what people need are the tools that they never had or never saw and therefore don't use. I often say to couples, how many courses did you take in marriage? Well, how did you learn about marriage? Watching mom and dad. How are they doing? Oh, they've been divorced for the last 10 or 20 years. Oh, so they were a good role model for how to be married, huh? You know, you can kid around. But it often happens that we do what comes naturally, and that's what we learn from observing others. And sometimes the people we observe are the last people you would ever hope to have somebody observe, right? So, assessment is really getting to the core of the problem. What is really causing all of this? And you will see degrees. You know, like a lot of things, there's mild, moderate, and severe. Well, any of you work in in-home family therapy? Okay. If you come to internship classes, you will hear from people who are doing in-home family therapy. And they start naming off all the problems in the family. And they get through naming them all, and they will say, and the whole class will say, oh my gosh, I'm overwhelmed. Where do you even begin? They are coming from a group of core beliefs that came from a really bad childhood. But we have degrees. We have people that were raised in healthy families, and they can have mistaken beliefs. We can have some families that have had problems. We have some mistaken beliefs there. But the more problems there are in the family and intergenerationally in the family, the more mistaken beliefs are going to develop and the more difficult the case is. And we have to assess and try to understand what are the core beliefs that are going on here. And sometimes they're intergenerational. If you do a genogram and do 3 generations and you say, holy cow, this mistaken core belief's carried on from one generation to the next. Every man in this family has abused his wife. They just think that's the way you treat women. You know, or it could be the same kind of thing about the women. Well, all women in this family have been controlling. Naturally, this person's gonna grow up believing that this is the way I should be if I'm a woman. So it could be intergenerational, it could be as a result of trauma, it can be just a result of their interpretation of things that happen in their life. And some of you may have heard this story, but I think it says it all, that, you know, no matter what kind of family you were raised in, you're gonna have some mistaken beliefs, and those mistaken beliefs can prove to be problematic. And my example of this was a couple that I know, very good friends, known them for years, wonderful couple, healthiest couple you could ever run across, did a fabulous job of raising their 2 sons. We get together, the sons are in their late 20s, we get together, and the mother says to me, I'm so proud of my boys, they're both in therapy. And I looked at her like, what? I said, why are your boys in therapy? I mean, they couldn't have had a better upbringing than what they got. I mean, talk about ideal parents. They were it. She said, well, they said that we had such a healthy family that we didn't really have problems, and so they never learned how to deal with problems in their life. And it's created a problem for them. So this gets all of us off the hook. Because you could be a perfect parent, and guess what? Your kids are still gonna come out with mistaken beliefs. Some more serious than others, depending on the repetition. So, you know, if you're told by a parent, I wish you'd never been born, you're worthless, you're no good, you know, you're hopeless, you're gonna have some major problems and major mistaken core beliefs, and trust me, there are parents who have done that to their kids. And then you might have something like you're a little kid and you wanna please your mom, and you know, if you don't please her, she gets mad at you and you don't like that, so you decide, well, I should always please my mom, and then you just go to the next step and say, well, I should always please everybody. And then I feel terrible if I don't please everybody. I should always please everybody. Mistaken belief creates problems for you, and you've been pleasing everybody for 35 years and you're miserable and you don't know why. Because you've been doing it the way you thought you should. Everybody else is pleased except you, you're miserable. So, you see, they're all degrees, and some people may have just 2 or 3 little mistaken beliefs that aren't gonna devastate them or keep them from functioning in the world. And then there are people who, well, they just said it on TV in the last couple weeks. They said there are 3 times more people on disability now than ever before, and it's all for psychological disabilities. The increase, the 2/3 increase is from psychological disabilities. So, guess what? Somebody doesn't know how to work with psychological disabilities. Mistaken core beliefs. Okay? All right, any questions about assessment? All right, we are gonna take a break, and then when you come back, we're gonna talk about the other 2. Okay? 15 minutes, see you about 5 to 8.
How far is it? How long do you need this? 8 pages?
Okay, come and tell me.
Oh, I thought so.
You're Beth, because I need to write this down.
I know.
Okay. Forgot your last name. And you're gonna miss what? Okay.
I was off last session.
Oh, you were?
So you're gonna miss about 3 hours on the second.
Oh. I bought a house. Really? I did.
Yeah.
I'm really cold. I was just thinking of like a sewage and hot water.
Okay, what you need to know is that you're up here.
I had carrots in here. It's okay.
So
I
that's
mean, I
it.
guess it was somewhat interesting.
All right?
And there's videotapes.
Yeah, if I
Yeah, I
can
still have a
remember.
lot of homework that I have to finish for that class.
Really?
Yeah, like, he didn't even make it to the final project until next week. So it's like, but I think after this, I'll take it first. Just like in the
Okay, everybody ready? The next phase that we're gonna talk about is the intervention or insight phase of psychotherapy. So we have now assessed, we have come to understand what the mistaken beliefs are, the problems are, what the symptoms are, what everything is. And the next phase is when we are now going to intervene with the client to start the process of change. And to start the process of change, we want the client to get insight into the problems, into what caused the problems, insight into what they could do differently, right? So, part of intervention is helping the client see what's behind the problem. They've named the problem, but oftentimes what they stated as a problem is really the effect that happens as a result of the cause, right? So, for example, I had a man in my office who said, "My marriage is in trouble because my wife is always angry. You need to get her to stop being angry and we will have a wonderful marriage." Now, from his point of view, the problem is that his wife is angry. But what is really the underlying problem? What is he doing that is making her so darn angry, right? And where did this anger that he has, or not anger, but his way of dealing with her that gets her angry, where did that come from? What kind of beliefs did he develop in his early childhood that led him to believe that this is the way he should deal with a woman? So you might teach him communication skills, and they'll come back and we're supposed to practice the communication skills, but she'll say, well, he started, but then he did what he always does. He put me down, he called me names, whatever he's been doing all along. So even the best techniques that you have aren't working. And they aren't going to work until you find out what the real cause is. The mistaken belief or beliefs from early childhood. We have to help them also to discover how they came to feel inferior. And it was based on inaccurate perceptions. So I screwed up, so I'm inferior. I was wrong, so I'm inferior. Mistaken beliefs. They developed in a situation, and then it became hardwired into their brain that this is the way it is. If you make a mistake, you're inferior or worthless. Not true, but we have to find what it is and when and how it occurred. So they begin to understand from the point of view of adult logic, looking back on their past, how an innocent child could have come up with that mistaken belief, quite honestly, because they couldn't reason as an adult can. And maybe it was a smart move on their part to survive in a really crazy situation. So, for example, if people got into fights and people were getting hurt at your house all the time, as a child, you might believe that when there's conflict, you should always go and hide out. Pretty good solution for a 3 or 4-year-old. Helps them to survive. But what if this little boy grows up, he gets married, and his wife has an issue with him, and she starts to have a discussion on a conflictual situation, and he walks out and goes out to the garage or gets in his car and drives away. And wonders why she's ticked at him when he comes back. But that was what he learned in early childhood. And also, people learn things that lead them to believe that they are not worthwhile. And here's a question I ask again and again and again, and I'm going to keep asking until every single person gets it right. What makes a person worthwhile?
The fact that they were born.
Thank you. She was in my last class. Did you hear that answer? By being born, you are worthwhile. It is innate. You are uniquely worthwhile individual. Nobody can give it to you and nobody can take it away from you. But you will find, I would bet you almost every single client thinks that they have to do something to be worthwhile or somebody has to do something to them to be worthwhile. They think it comes from out here somewhere. That people bestow it, people take it away. Or I have to do something to gain worth. If I do everything perfectly, then I'll be worthwhile, right? If I'm always successful at everything I do, then I'll be worthwhile. And of course, they never quite make it because it's often very perfectionistic what they've decided. So if you don't do anything else when you work with clients, work on that. Because the only way they can get to the horizontal plane is when they feel okay about themselves as a person. Until then, they're feeling inferior and their whole focus is going to be about moving from the inferior position to the superior position. And we want to move them to the horizontal, right? Only way that's going to happen is when they value themselves and they realize that they're a valuable human being and they don't have to do anything to earn it or to keep it. Okay? So we have to help them to identify their own mistaken goal, which is the fictive goal. The fictive goal is what they think they have to be or do in order to belong, have significance, and feel safe and secure. Their mistake is they don't have to do anything.
Could you repeat that?
Yes, I said that the fictive goal is that what they think they have to be in order to be significant, worthwhile, belong, and feel safe and secure. That's incorrect, it's mistaken. They don't have to be anything except themselves. But if they don't realize that, they're always trying to be something other than who they are in order to fit in and belong and have significance and feel safe and secure. Then there are the mistaken beliefs they have about others and the world and so forth. Those are beliefs that we have to help them recognize as mistaken, first of all, and then give them insight in, help them to get insight into what is the common sense belief. So for example, all women are stupid. Now, what would the common sense belief be about women and intelligence?
Intelligence is varied.
Intelligence varies. Women have a variety of abilities in terms of intelligence. There's nothing, no extreme here, right? And we look for those extremes and we help them to understand what the common sense belief would be. Common sense is if you lined up the general public and asked them, they'd pretty much all come up with the same answer. That's common sense. And what's interesting is that your client will always have common sense when you ask them about somebody else with the very same situation. But when you ask them about their situation, their answer is with private logic. So if you took what they believe and you put it on their child and say, okay, your child comes to you and says, I screwed up today in school, I'm worthless. What would you say to your child? And they will immediately come out with common sense. But they will have the very same belief about themselves and will only see it with private logic. But sometimes putting it out there on somebody else can help them to begin to see what the common sense is and then begin to apply it to themselves. So they have often distorted and irrational ways of thinking. And we have to help them to identify it and find out what the logical or rational view would be. And we have to confront what is not logical or rational or common sense. If you do not, and confront doesn't mean in your face attack. You can do it in a very caring way, but if you do not challenge the client, they don't change. So you do have to get them to face up to what it is so they can do something about it. And if you don't, they will use it on you. That's another little goodie to remember. We have to help them get some insight into the purpose for their behavior. Because remember, all behavior has a purpose, and the purpose is to achieve a goal. And they need to begin to understand why they behave the way they do. What is the goal they're trying to achieve? And is it a logical goal? And if it's a logical goal but the wrong way of achieving it, you can help them to get some insight into other ways to achieve it. With children, we will often say that they have a mistaken goal of attention getting. And they believe that it's only with attention that you really have value and worth as a person. Well, one, we have to help them to know that they have value and worth irrespective of their behavior. But also, there are useful and useless ways for getting attention, and the attention would not be for gaining worth, but just because you enjoy it. And you can get recognition for the things that you do that people appreciate or enjoy or get a kick out of or whatever. And so we can begin to help them to channel what they are doing on the useless side of life to the useful side of life, right? So we also have to confront inappropriate behavior. We have to challenge inappropriate behavior. Because people don't change unless it's held up to them that this is not appropriate. And they may not know any other way to be, so they have to get some insight into another way that would work better. So we're not just getting them insight into why they got to be the way they are or what the problem is, but also insight into another way of looking at it or another way of doing it or another way of thinking about it, another way of feeling about it. So, it's like the cup is half empty or the cup is half full kind of approach to things. Anytime a client says something that's really negative to you, you can give them another way of looking at it that could be positive. My mother that never has anything nice to say about me, she criticizes me all the time. I feel worthless because all I ever hear from her is criticism, and now she won't even speak to me because there's something I said or did that wasn't to her liking. And I would say, wow, isn't that great? You're gonna get a month off. you know, and say, guess what? She's not gonna stay away forever, cause she's gonna be dying to come back and criticize you again, but just enjoy the peace and quiet for a while. No criticism coming from your mother, isn't it wonderful? It's like, oh, I never thought of it that way. You know, so sometimes the insight is just giving them another way of looking at the very same thing. So that's intervention. So as you see, intervention is a beginning of understanding what is happening, why it's happening, how it came to be in the first place, and what could be done differently. The final stage is reorientation. Now, insight is really where the therapy is going on. But then reorientation is after the client has this insight, after you've intervened and they begin to understand the common sense, now is when they have to do something to change. That's reorientation. That's when they start considering alternative ways of being, alternative ways of thinking and doing and feeling. They start acting on that. And we are there to give them the courage to try doing it differently, thinking differently. It's scary to change when you don't know what's going to happen. And we're there to give them encouragement to try it. We are now converting insight into action. This is the action stage of therapy. This is where we hold the client responsible for changing. We support them while they do it. We make them aware of when they slide back into old ways of doing things and remind them, this is the way you used to do it, this is based on the old belief, is this the way you want to do it now? We assure them that they're worthwhile, they belong and have significance even when in the process of change they're screwing up. Because you know, when you try to create a new habit, you don't do it right every time while you're developing the habit. You make mistakes, you slip up. Give them all kinds of support for acting in a different way. We encourage them to try new ways of dealing with things, of approaching things, of behaving toward another person in a different way. And we remind them of the ineffectiveness of the previous behavior. It's kind of like, you know, Dr. Phil, he's always saying, well, how's that working for you, right? He's pointing out how ineffective it was, the way they were doing it before. And by identifying and acknowledging that it's ineffective, they're more open to trying something different. We encourage them to act as if things are the way they want it to be, instead of the way they believe it to be. And in acting as if, they really start building a habit of behaving in a different way, and eventually thinking and feeling in a different way.
What's a good example of something when you dealt with a client acting as if? I mean, could you
Okay.
just give an example of that?
Sure.
please? Thank you.
I had a woman in my office who was extremely shy. And her boss, and she didn't like the fact that she was shy. She wished she could be friendlier, but she just got extremely anxious. And her boss had told her he wanted her to go to this conference. He didn't want to go, but he wanted somebody to be there. He selected her to go. It was a dinner deal with a speaker kind of thing. And she was just beside herself because she knew it was going to be just awful. She was going to go, she was going to sit there, she wouldn't know anybody, she'd feel weird and worthless and awful, and it was going to be the worst night of her life. And so what I said to her is, okay, this is a group of people you don't know, right? Right, she doesn't know anybody there. So I said, well, you know, this would be a good opportunity, try something different. And I said, here's what I'd like you to do. I would like you to go to that conference and look around the table, or at all the tables. They were, she said they were gonna be kind of in a square kind of thing, or, you know, tables around like this. And I said, I want you to look around for somebody that looks like they feel uncomfortable. And I want you to go over and act as if you're a friendly person to this person. And I want you to go up to her, and in acting like a friendly person, you own that you know you're really kind of uncomfortable because you don't know anybody here, and you just thought you'd come up and introduce yourself and say hello. That's all you have to do. Just try it out. You'll never see this woman again, so if you blow it, who cares? You know, you'll never see her again. Would you be willing to take the risk and do this? So she thought about it. She said, okay, it'll be kind of scary, but I'll do it. So she comes back the next week, big grin on her face. I'm like, well, how'd it go? She said, you will never believe what happened. Like I wouldn't know. She said, I went over and I said to this girl, you know, I don't know anybody here and I feel kind of weird and awkward, and so you look like you were kind of all alone, so I just thought I'd come over and introduce myself and say hello. And the girl just gushed all over me. Oh, thank you for coming over and talking to me. I was feeling so terrible. You are the nicest person, blah, 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 blah. And they hit it off, and they were just big friends from that moment on, all because she acted as if for 5 minutes. But it flew in the face of her belief. When we don't force, but when we push somebody out of their comfort zone, you know, what's comfortable is often not a good comfort, it's just what you're used to. When we push them out of their comfort zone, even for 5 minutes, we are helping them prove to themselves the exception to the rule. So sometimes my assignment, and this is another thing we do in reorientation, is we give assignments, because the work is really done between sessions. The growth occurs between sessions when they take action and do something. So I will give them a little something to do that's outside their comfort zone and outside of their beliefs, and have them try it. Sometimes they have to take out insurance. You know, what it means to take out insurance is, you say, another example I have is when I'd ask somebody who works in an office to act on a common sense belief instead of a private logic belief for one day at the office. And I'd say, now, but I'm gonna give you an insurance policy. Would you be willing to do this for one day? And if things don't work out, you come to work the next day and you tell everybody that you have this horrendous migraine and you just weren't yourself. And if you said anything weird or awful, you apologize. You know, and so that you get off the hook. So as long as they have the insurance policy, they say, okay, if I have the insurance policy, I think I could do it. And sometimes it has to be half a day, sometimes it has to be 15 minutes, depending on what they can handle. And they come back and they say, well, what happened? Did they all get upset with you? No, people are really nice. And well, how'd your day go? It's the best day I've had in a long time. Wow, do you think you could do that for a couple days? Yeah, I guess I could try it again. Worked all right for one, maybe it'll work for two. You see? So that's the reorientation stage. That's the stage where we help them to start to think differently, to feel differently, to act differently. And baby steps. Remember, you don't teach somebody to swim by throwing them off the deep end. You start by helping them get their feet wet. So baby steps sometimes. Like, I'm trying to think of that movie,
What
All
about,
About Bob, one step at a time, you know, okay? All right, any questions about that?
I
Yes,
just had so is the intervention stage kind of the awareness stage?
yes, that's where they really become aware of what the belief is, why they act the way they do, you know, why they feel the way they do, and why they overreact to things. That's often a sign. When people overreact, it's because of a core belief. So that's a good way to find a core belief. When your client is overreacting to something, you're thinking, why are they so upset about this? This is not a big deal. You can ask them for an early recollection, they'll take you right back to a mistaken belief. Because that's why they're overreacting. All right? Any other questions?
do you find that a lot of mistaken beliefs are similar in your clients? I mean, I can see some mistaken beliefs being difficult to identify.
Well,
I don't know.
remember in lifestyle, there were a list of typologies that Mozak came up with? And those were some that he saw more commonly amongst his clients. And this is what you will discover. As you see clients, you begin to say, oh, I've had one of these before. I know what this is about. This is a pleaser, you know. Oh, I've had that before. This one's a controller. You know, the more you work with these people, the more you start to quickly identify a core belief. At least you have this hunch about a core belief. You have to check it out. But it's true that there are certain themes that tend to predominate amongst clients that you see.
Is there a danger in falling into a pattern if you have a tendency to see a particular typology that you go looking for that?
Well, always remember, we never state as a fact a mistaken belief. We only have educated guesses or hunches.
Could it be?
And we always check them out with the client. And if the client says nope, we drop it. So we are not the final authority, and that's why we say we are equal collaborators. Our client is our partner in helping figure this out. And so we check everything out with them, and we may be right, we may be wrong, and you can say that, you know? All I can do is guess at some possibilities based on what I'm hearing. Could it be that you believe this? And they'll say yes or no. And you know, if they say no, that's not it, and you say, okay. You're also showing them it's okay to be wrong. No big deal. Move on. And they can be wrong too, and no big deal, move on. Big, big, important message. So we're not only helping them to discover mistaken core beliefs and what is common sense, but we're acting it out in the therapy session. Oftentimes, I have heard a client saying, I've never had a relationship like this with anybody. I've never been treated like this in my life before. I never knew it was possible to be treated like this. But you know, if you've always been put down, abused, and mistreated, you think that that's the way people get treated. I had a friend once who was verbally abused by her father, verbally abused by her brothers, and verbally abused by her husband. She thought it was normal, because that's all she'd ever known. First time she ever even considered that maybe it wasn't, when I said, do you realize that that is not the way a woman should be treated? She was like, really? Really? That's verbal abuse. Really? Yeah. But that's all she'd ever known, so she didn't know any different. So sometimes people have to be made aware that what they believe, based on their experience, no wonder they believe that. That's all they've ever experienced. But we have to open their eyes to what is really true. Okay? All right, so here's what we're gonna do now. Your role play for tonight is going to be about building a relationship. So the first thing I'm gonna do is I'm gonna ask for a volunteer, maybe somebody who has actually worked with a client, to play that client just for a few minutes. And I will be the therapist and I will demonstrate to you how I would begin to build a relationship with you. And then you are going to be divided up into teams of 2. One of you will be the therapist, one will be the client. And you will practice trying out building the relationship, okay? And remember, the assignment is not to fix the problem. It is to build the relationship. One of the biggest mistakes that students and new graduates make is they start to solve the problem before they've built the relationship, before they found out what all the problems are about. And you know, if you start fixing a problem, guess what? Oftentimes, the client starts out with the least of their problems. And by the end of the session, if they really feel like they connected to you, then they drop the bomb, the really bad stuff that's going on. So if you start working on some problem they bring up in the first 10 minutes, they get to the end of the evening and they're figuring, you know, this isn't gonna work for me. I didn't even wanna work on that problem. And we spent the whole session on a problem I didn't wanna work on. So you really have to understand and active listen and really understand where your client is coming from before you step in, okay? Is there somebody that thinks they could play a client that they have had? Or somebody you know? You could play a friend if you want to that has problems. You'll do it?
Sure.
Great, Annie. All right, we'll bring another chair up here. Okay, and you don't have to use a person's real name, or you can use your own. But what name should I be calling you? That's the client. Ann, okay. So, Ann, tell me a little about what's going on that you came in to see me? What are the problems that you're having?
I have really bad anxiety.
Bad anxiety, okay. Can you tell me more about that? Can you describe for me what happens that you begin to feel anxious?
Well, my body just, my heart starts pumping. I don't wanna go outside. I don't wanna see people.
Uh-huh, okay, and how often does that happen?
Every day.
Every day it happens?
Yeah, it's getting kinda bad now where I feel like I'm having panic attacks.
Uh-huh, okay. Now, when did you first start having feelings of anxiety? How far back does that go?
Probably 10 years.
10 years. Okay, well, could we go back 11 years? What was going on in your life 11 years ago?
Oh, I was working, I was married, life was good.
Life was good. And then, so that was 11 years ago. You had just been married or been married for a while or?
I'd been dating my husband for a while and then we got married probably a couple years before that.
Okay. So things were really going well for you 11 years ago. Okay, and then let's move forward. How about 10 years ago? How are things going then?
Well, I got injured on the job
Oh.
and so I had some back surgery.
Uh-huh.
And ever since then, like, it's just gone downhill.
Okay. So you had this back surgery. And what was the result of the back surgery?
Not very good results, because I ended up having 7 more
Oh my. Okay.
over the last 2 years.
Okay. So you had back surgery, you were not now able to work,
Right,
and you still had back pain.
right, well, I got medications and, got addicted to those, so.
Okay, so here
Was
you
taking-
are now, you had this good life,
Mhm.
then you lost your job, you hurt your back, you had to be on medication for the pain,
Mhm.
then you got addicted to the medication for the pain.
Mhm.
Okay, at what point did the anxiety begin?
Probably just kind of in the midst of all those surgeries and not being able to work and, you know, taking more medications for the pain and just, you know, I don't know if there was a
Did you have
turning
children by
point.
this time or not?
No, no children.
Thank goodness, huh?
Yeah.
Yeah, okay, so as you had more and more surgeries, can you think about the first time that you started to feel anxious?
There wasn't a turning point.
There wasn't a
I-
time that you remember where you really recognized that you were feeling anxious?
Well, my mother had died.
Oh, add that.
Yeah.
Wow.
And so,
Several surgeries, no job, and now your mother died, and addicted to medication.
yeah, I don't know that I really thought that I was addicted because I just was taking them all the time because the pain was always there.
Oh, okay, okay.
So I just recently kind of,
Did that affect how you were? I mean, was this something that made you feel dopey, or did it affect the way you felt in your head when you were taking medications for pain? Does it affect you that way, or just dealt with the pain?
it dealt with the pain. I mean, you know, taking as much as I did, I'm sure the loopiness was just kind of normal.
Yeah,
So,
okay, so it did make you feel loopy, or act loopy.
Yeah, I mean, it was hard to move around because of all the pain in the back
Sure.
and just the body pain.
So it was just hard to get through the day?
Yeah,
Okay, and so was now, and then your mother died, now was that sudden, or did she
no,
have
she
a
was ill,
declining-
yeah, she was ill and cancer.
Okay, and so here you are dealing with a dying mother, and you're with back pain, right?
Yep, and my wife, excuse me, my husband. I should have been a man.
Yeah,
You know, he's having to do, you know, all the house duties and
your husband is having to take care
Yeah.
of household responsibilities because of your back pain and
Right.
because of your mother. Are you trying to take care of your mother while she's dying?
no, I would just visit and,
Okay,
you know,
how was that for you, the fact that your mom was dying? Was that hard for you?
oh, sure,
Or, I mean,
yeah.
were you close to your mom?
Yeah, we had a pretty good relationship.
Mm-hmm. And any resulting effects of the fact that your mom died? Did you move through that all right, or did you kind of stop it because you had all this
You
pain
know,
and all this other stuff?
Right after she died, my sister died a couple years later,
Wow,
cancer.
wow. And then I suppose you might start worrying about whether you're gonna get cancer, huh?
Yeah.
And that,
Mhm.
did you start feeling anxious about the possibility of getting cancer?
Yeah, I just felt like my health was declining, I mean,
Uh-huh.
with the body pain
And what was your greatest fear?
Man, that's my client then. My greatest fear was just, you know, that I would never heal.
That you'd be this way forever, or worse?
I would never be able to work again.
Ah, work is very, very important to you. I see. And tell me more about, what did work mean to you?
Well, it was, you know, just giving me that purpose to do something every day.
Mm-hmm. Did it really make you feel good to be able to work?
Yeah.
got a lot of satisfaction out of that.
Mm-hmm.
Uh-huh. So you lost your means of getting satisfaction. Okay,
I could say that.
so if you don't have work, why is it worth leaving the house?
Mhm. Well, if I can't work and I can't walk around because I don't feel good and now my family's gone and it just seemed
So,
not worth living.
so I hear that you are really aware of all your losses.
And that was just in that time frame. I mean, over the 10 years. We got a divorce. And then
Oh, another loss.
Yep, and then my husband died,
Wow,
then the dog died.
wow, you name it, huh?
Yeah.
Well, no wonder you don't wanna leave the house. Can you see why maybe you wouldn't wanna leave the house?
Yeah.
What's gonna happen if you leave the house?
Somebody might die.
Well, certainly.
I might die.
Well, certainly if you go out of the house and get connected with people, maybe they'll die too, huh?
Mm.
It sounds like you've lost everybody that you ever connected with. So what is the positive payoff for staying in the house for you?
Safe. Safe, and, you know.
What's the
I heard-
negative consequence of staying in the house?
The negative consequence of staying in the house,
And not going out?
well, I'm lonely.
So you're safe and lonely. How's that working for you?
Not too well.
Not too well. Do you wanna do something about it?
Yeah, I do.
You really do?
Mhm.
Okay. So you're willing to do some work and see if you can't make things change a bit?
Yeah.
Okay. Well, what do you think? Would you like to come back? And see what we could do and see if we could work to try to make things better? Cause I think we could.
Mhm.
If you're willing to, we're willing to work on it, I think we could get better.
Well, I got here today, so
That was
I'm
a big
sure,
step, wasn't it?
I'm sure I can come back again.
Well, that's step one,
Mhm.
isn't it? Okay,
Yeah.
all right, so we'll make an appointment and get together again next week, and I bet you'll get here.
Okay, great. Sounds
Okay.
good.
All right,
Thanks.
okay, thank you. Okay, so what did you notice in terms of building the relationship? What did you see in terms of building the relationship?
More problems come out.
More problems came out. How did they come out? What did I do to build this relationship?
You got validated her experience. Of course you would be having all, I mean, look at what's happening to you.
Yes. Makes perfect sense that you feel this way based on what was happening. What else?
Identified her purpose for seeing you.
Mm-hmm, mm-hmm.
And you paraphrase what she was saying to validate that you're hearing
Yes,
her correctly?
repeated back in some way what she was saying to me to validate that I was really hearing her.
Instead of judging, the addiction and that kind of thing, you had empathy for how she got to that place.
Yes. Right, non-judgmental, empathetic to what her circumstances were that would have led to that happening. Anything else?
You asked a lot of questions to gather more information.
Yes. And you know what, when you ask somebody a lot of questions, how does that make a person feel?
Important.
Important?
Important.
Yeah, like, oh, you're really interested, you really wanna know. And in playing the client, what happened that made you feel like you were building a relationship with me?
Well, you seem genuinely interested.
Genuinely interested. That's really important.
And the eye contact was there, and definitely empathetic, but there was a point, cause this is a client that I have.
Uh-huh.
And there was a point that it turned in me, because there was, and I think it was, no wonder you don't wanna go outside. I mean, it was kinda like, wow, I would feel that way too if I was in your shoes.
Yes. And that's saying, you know, this is normal behavior if you're looking through the eyes of the person with the private logic. If I were in your shoes, I would have done the same thing. It makes the client not feel like I'm not crazy. This makes sense to somebody else based on what happened to me and my perception of it.
So there's two questions, what would be the positive to stay in, or the negative to go out, I can't remember what you said.
I asked what would be the payoffs for going out and what would be the consequences? Or what are the payoffs for staying in? Let's see, I can't even. What are the payoffs for staying in, and then what are the consequences for staying in? It helps a person really put things into perspective, doesn't it? And then they have to examine whether the payoffs are worth the consequences. Okay, do you get the idea? Now, I didn't really solve any problems here. I just connected with my client, asked a lot of questions, showed an interest, gave her hope at the end that things could get better if she was willing to do the work, encouraging, all the things we've talked about. So what I want you to do now is that we're gonna split you up in twos. One of you will be the therapist, one of you will be the client. And the person who's the client needs to think, I'm sure everybody here has run into somebody in their life with problems. Because it's not possible to get through this life without knowing somebody with problems. And not just a problem, problems, you know, because there are problems. Maybe there's one thing that causes the problems, but as you heard here, the problem was maybe the back surgery to start out with, but a lot of other problems developed as a result. So I want you to play that person with problems, but I want to remind you, we are not playing Stump the Therapist here. So you don't want to try to make it as hard as possible for your partner. You want to just play somebody you know that has had some problems and give your partner an opportunity to practice building the relationship. And when you're done, and we'll only do this for 10-15 minutes, I want you to give your partner some feedback. One, what really worked, but if there was something that didn't work for you, tell them. Wouldn't you want to know so you don't do it with a client? And this is not putting down the other person, this is helping the person to be a better therapist. So you say, well, when you did that, that didn't really work for me. That kind of started making me feel kind of angry, or whatever is happening that's useful information. Your partner's not going to get graded down for it. This is the first class, and I'm not grading you on this. Just do the best you can and get the feedback, and you will discover by the time that we get to the last class, you'll be doing really well as a therapist because you'll have had a lot of practice. Okay? Any questions before you do that? Okay, would you mind going and pushing the little red button on the back of the video? Thanks. Okay, so I'm gonna hand out